Hey there, sightgoers. Welcome back. When we first meet someone, one of the main things that we pay attention to are their eyes. We look into their eyes to get an idea of who they are. Depending on what we see, it can make us like them more or less. And since eye contact is one of the most intimate things that two people can share, it's important to know how to do it properly. It's no surprise then that if someone doesn't blink at all, it would be very off-putting to see. But what does it mean when someone never blinks? Today, let's find out in He Never Blinks. Even when you do? No. 1. They have an underlying medical condition. According to Healthline, blinking is a reflex that we don't have control over. It helps to wet, clean, and protect the eye from any debris. So you can imagine that not blinking at all could cause some serious irritation and dryness in the eye. In fact, this is one of the first symptoms of a medical condition called blepharospasm. Blepharospasm is when someone has uncontrollable blinking or spasms of the eyelid. This condition is extremely rare, but it can be quite painful. Other symptoms include pain in or around the eye, burning and gritty sensations in the eye, excessive tearing, discharge from the eye, and sensitivity to light. If you notice that you or someone you know is experiencing these symptoms, then it's best to seek professional help immediately. No, 2, it could be a side effect. There are many different kinds of medications out there, each with their own list of side effects. Some of these side effects can be mild, while others may be quite severe. It's why it's always important to read the fine print before taking any medication. But did you know that one of the side effects of taking antihistamines, antidepressants, and anti-anxiety medications is the inability to blink? That's right. These are some of the possible side effects that come with taking these medications. So if you or someone you know is experiencing this side effect, then it might be a good idea to talk to your doctor about switching to a different medication. No. 3. Botox may be the culprit. Botox has become a common treatment for those looking to reduce the signs of aging. For those who don't know, Botox is actually a nerve toxin, and when injected into the skin, it blocks the nerves from sending signals to the muscles, which causes the muscles to relax. This in turn reduces the appearance of wrinkles and fine lines caused by repeated facial expressions. While this might sound like a great idea, it also comes with its fair share of risks, especially if it's done incorrectly. One of the more common side effects of Botox is the inability to blink, and it makes sense since Botox is injected around the eyes in order to smooth out the skin around the brow and upper eyelid. So if you think that your friend's weird inability to blink is because of Botox, then you should ask them if they've gotten any work done recently. No. 4. Something in their eye. Oftentimes we blink to get rid of anything that gets in our eye. It could be dirt, dust, hair, or something else. And if it's really bad, it could even lead to an infection. The thing is, sometimes something can get into our eye and we don't even realize it. It happens so often that most people do, and even notice when it's happened until someone points it out. So if you ever going to have a deep conversation with someone, and they still do and seem to blink, it's a good idea to check if something's gotten in their eye. You could try doing it gently, or you could just tell them straight up. After all, it's better than letting them walk around with something stuck in their eye. No. 5. It could be a sign of disrespect. When we're having a conversation with someone, and we don't want to be there, we tend to look away more often. We might look around the room, look at our phones, or simply stare off into space. What we don't do is make eye contact with the person speaking. Why? Because it would be rude. We'd rather show them that we're uninterested than have to listen to what they have to say. And the same goes for not blinking. If someone is speaking to you and you don't blink once throughout the entire conversation, then you resending them a clear message that you do unrespect them or what they have to say. Not blinking can be seen as a form of passive aggression where you clearly showing that you've annoyed and you want them to stop talking. This is why it's a good idea to make eye contact with the people you're talking to. By making eye contact, you're showing them that you're interested in what they have to say, even if you don't agree with it. No. 6. They could be hiding something. Ever wonder why criminals in movies always wear sunglasses? Well, it's because they're trying to hide their identity. By wearing sunglasses, they're able to get away without being recognized. But aside from covering their face, They also try to avoid eye contact. Whenever we meet a new person, we make eye contact with them. It's only natural that we want to get a good look at the person we are re-speaking to. But when someone refuses to look into your eyes, it sends a clear message that they're hiding something. Maybe they trying to cover up their identity, or maybe they just trying to hide the fact that they lying. Either way, if someone never blinks or looks away during a conversation, then they're probably hiding something. No. 7. It could be a tic disorder. Tics are sudden repetitive movements or vocalizations that are done unconsciously. They usually occur in childhood, but they can affect adults as well. There are different types of tics, including simple motor tics, such as eye blinking or shoulder shrugging, and complex motor tics, such as touching objects a certain number of times or making specific gestures. Some examples of vocal tics include coughing, throat clearing, and sniffing. And complex vocal tics involve repeating phrases or words. Often people with tic disorders have tried to suppress their tics, but this usually ends up making the tics worse. There are treatments available to help manage tics, including medication and behavioral therapy. So if you or someone you know is struggling with a tic disorder, please seek professional help. Don't. 8. Certain eye conditions. Having certain eye conditions can also play a role in someone's inability to blink. This is because eye conditions can cause a lot of irritation and inflammation in the eye, which leads to the inability to blink. Dry eyes, blepharitis, and conjunctivitis are just a few examples of eye conditions that can cause someone to not blink. People who suffer from these conditions will often experience a gritty sensation in their eyes, which is extremely uncomfortable. And since blinking helps to lubricate and clean the eye, the inability to do so can aggravate the eye even more. Thankfully, there are treatments available to help alleviate the symptoms of these eye conditions. So if you're suffering from a similar issue, make sure to speak with an eye specialist today. And no. 9. Aging. As we age, our bodies go through a lot of changes. Our skin begins to wrinkle and sag, our hair begins to gray, and our eyes begin to droop. It's all a part of the aging process, and there is nothing we can do to stop it. But did you know that aging can also cause us to not blink anymore? That's right. As we get older, our eyelids can start to droop, which can cause our eyes to water and dry out. This can lead to a gritty feeling in the eye, which can make it difficult to blink. But the good news is that this problem can be fixed with surgery. By removing some of the excess skin from the eyelids, the eyes are able to blink normally again. So if you or someone you know is struggling with this issue, then it might be time to schedule a consultation with a plastic surgeon. Did you relate to any of the points above? Let us know in the comments below if you found this video helpful. Be sure to like, subscribe, and share this video with those who might benefit from it. And do not forget to hit the notification bell icon to get notified whenever a new video is posted. The references and studies used in this video are added in the description below. Thanks for watching, and see you in the next one.